Praise be to Allah, the cherisher and sustainer of the worlds. I'm Dr. Ramsha Mushtaq Khan, and today I have the opportunity to present critical appraisal on rationale and approach to evaluating interventions to promote child health in low and middle income countries under the kind supervision of Professor Dr. Saira Afzal. I will be using PRISMA checklist for reporting of this systematic review. PRISMA checklist is a 27 items checklist, and the presentation includes comments on title and abstract, introduction, methods, results, discussion, other information, strengths and limitations, and summary of key points. Title and abstract. Title: Rationale and approach to evaluating interventions to promote child health in low and middle income countries. The title accurately reflects the content of the review. Abstract: The article describes the rationale and approach used to evaluate interventions aimed at improving health and well-being in school-aged children and adolescents. The authors prioritize evidence derived from Cochrane reviews and other high-quality systematic reviews that synthesize evidence from randomized controlled trials and quasi-experimental studies. A total of 18 systematic reviews were included in this supplement, covering a range of interventions such as physical activity, nutrition, mental health, substance use prevention, and sexual health education. The authors conducted a narrative synthesis of the included studies due to heterogeneity in study design and outcomes. The risk of bias within individual studies was assessed using the Cochrane risk of bias tool for randomized trials. The grading of recommendations, assessment, development, and evaluation approach was used to assess the quality of the body of evidence for each outcome. The authors provide an overview of what is currently known in terms of evidence for effectiveness, but note that their descriptions do not imply that other interventions were ineffective simply because there was an evidence gap. Overall, this supplement provides a comprehensive assessment of the available evidence for interventions aimed at improving health and well-being in school-aged children and adolescents. Introduction. The introduction provides background information on the topic and clearly states the research question, rationale, and objective. Methodology. The methods section describes the research strategy, study selection process, data extraction methods, and quality assessment procedures in detail. Results. The results section presents a comprehensive summary of the included studies and their findings. Discussion. The discussion interprets the results in light of the research question and provides implications for practice or future research. Other information. Funding. No sources of funding are disclosed in this article. Protocol and registration. No protocol was developed for this systematic review. Eligibility criteria. The eligibility criteria for study inclusion are clearly defined and reported in Table 1 of the article. This is the Table 1 summarizing the evidence review approaches used across school-age intervention reviews. Information sources. The authors search multiple databases, such as PubMed, Embase, Rationale, to identify relevant studies for inclusion in their review. Search. A detailed description of the search strategy used to identify studies is provided in Table 1 of the article. Study selection. A flow diagram showing how many studies were identified at each stage of screening is provided in Figure 1 of the article. This is the Figure 1 showing the conceptual framework of the child health domains and intervention review topics covered by the supplement. This figure shows the flow diagram of the journal review methodology used for each child health topic. Data collection process. Two reviewers independently filled a standardized data abstraction form to capture review characteristics of included studies and interventions, and pooled effect estimates derived from meta-analysis where they were reported. Page number 3. Data items. A list of all data items collected from included studies is not provided in this article. Risk of bias in individual studies. Assessments were conducted independently by two review authors. Scores were compared, and a final risk of bias judgment was reported for the included studies of each systematic review. Randomized trials were assessed using the Cochrane risk of bias tools across several domains. That is found on page number 4. Summary measures. The summary measures used to synthesize data across studies are not explicitly stated in this article. Synthesis of results. The authors conducted a narrative synthesis of the included studies that is identified at page number 5. However, they did not perform a meta-analysis due to heterogeneity in study design and outcomes. Risk of bias across studies. A description of how risk of bias was assessed across studies is not provided in this article. Additional analysis. The authors did not conduct any additional analysis beyond the narrative synthesis of the included studies. Risk of individual studies. Results of individual studies. A summary of the results of each included studies provided in this article. Synthesis of results. The authors conducted a narrative synthesis of the included studies. However, they did not perform a meta-analysis due to heterogeneity in study design and outcomes. Risk of bias within studies. The authors assessed risk of bias within individual studies using the Cochrane risk of bias tools for randomized trials. This is found on page number 4. Results of additional analysis. No additional analysis were conducted beyond the narrative synthesis. Limitations. The limitations section discusses potential sources of bias and limitations to generalizability. Conclusion. The conclusion summarizes the main findings and provides recommendations for future research and practice. Funding. No sources of funding are disclosed in this article. Summary. For the strengths of the article clearly states the research question and objective in the introduction. The methods section provides a detailed description of the search strategy, study selection process, data extraction methods, and quality assessment procedures. The authors assess risk of bias within individual studies using the Cochrane risk of bias tool for randomized trials. The discussion interprets the results in the light of the research question and provides implications for practice or future research. Limitations. The authors did not provide a flow diagram to show how many studies were identified at each stage of the research process. A list of all data items collected from included studies is not provided in this article. The summary measures used to synthesize data across studies are not explicitly stated in this article. The authors conducted a narrative synthesis of the included studies and did not perform a meta-analysis due to heterogeneity in study design and outcomes. Summary of key points. Overall, the article appears to have followed most of the PRISMA guidelines for reporting systematic reviews and meta-analysis. The authors provided a clear description of their research question, inclusion and exclusion criteria, search strategy, and study selection process. They also conducted a thorough assessment of study quality and risk of bias using appropriate tools. However, there are a few areas where the article could be improved. For example, the authors did not provide a flow diagram to show how many studies were identified at each stage of the process. Additionally, they did not report any information about publication bias or how they addressed it in their analysis. Overall, while there are some areas for improvement, the article provides a clear and well-structured approach to evaluating interventions that could be useful for researchers conducting similar studies in the future. Checklist used for critical appraisal. As I have mentioned that I have used the Prisma checklist. The checklist includes a total of 27 items. This is the reference of the Prisma checklist. Please like and subscribe our YouTube channel, and thank you very much.
Assalamu alaikum. Thank you, Dr. Rimsha. It was a nice presentation. Most of the points you mentioned, I got them, but some points were not clear, so I would give a brief and a bit detailed review. First of all, I would like to add here that whenever we are doing a scoping review for the systematic reviews, we use the Prisma extension for the scoping reviews. It is available online, and you can use this. And there are guidelines available for doing a critical appraisal for the systematic review, for the scoping review of the systematic reviews. So I would like to explain it for you as well, so that in future you can add those points in your slide, in your presentation. Okay, overall it was a very good review of the article, and you have read it very in depth, and you have pointed out many of the points, so I would highlight those as well. So starting with it follows the different guidelines that I would like to add few points. So it starts with the title. It's clear, relevant, and to the point, and explains what would be done and what would be assessed. As an abstract, I was unable to find it in the whole article. I don't know where it was. So maybe it's not as that applicable for the scoping reviews, but I could not find it. For a scoping review, there should be an objective. I think it was clearly stated, the aim of the study was clearly stated, and the objective statement exactly was not given, but the aim was clearly stated, what the authors want to do and what they want to see based on the review of the systematic reviews already published. Third point we go for as a scoping review is apply a PCC. So apply a PCC is population, concept, and context. So in this we highlight the population, the participants. I think that was done in the article. The concept and the context. The main concept is the aim of the study, why we are doing it, the research gap, and the rationale. And the context based on the framework for the search strategy, and breakdown of the question to check the any potential for missed inclusion, exclusion criteria, or any other points that is a part of that context. Protocol, third point that comes after PCC is the protocol. Protocol is actually the plan and the methodology for the scoping review. And it has an iterative nature, meaning that there is a repetition of knowledge, repetition of things, repetition of the concepts and the definitions and the things that are discussed. So there is, and it has an iterative nature. Then comes the introduction. It's a part of the protocol, and the protocol is divided into different parts. So the protocol starts with an introduction that is based on definitions, overall review or an objective statement, detailed of any preliminary research that was done in it. Overall review objective was given, definitions were given, explanation for the need of the review, and an eligibility criteria with contextualization and rationalism. It was all given in that introduction, so it was a good introduction. This is the first part of the protocol that we see in a scoping review. Then the sample search strategy and explanation of search approach, which means that which gray literature will be searched, and justification of choices of the studies that has been given. It was slightly briefly explained, but not in very detail. But they mentioned that which gray literature and which databases would be included in that. Okay. Later on, the fourth point in this protocol is the study selection process, including resolving disagreements between the authors and their contributions, and how the duties were divided and which author did what was explained in the article very well. and a draft charting table or a form for data entries and explaining the outcomes. It on the first page, on the second page, I guess it's in figure 1, you see that they have given a conceptualized framework, and the outcomes were also mentioned on that would be given. So this is the basic draft or the table or the framework that they presented in for the data, um, and for the outcomes were mentioned, and how results and data will be presented, either in the form of draft chart, figures, or flow sheets. That was mentioned in that portion of methodologies. Then establishing an inclusion and exclusion criteria, it was given over there. And the next point is the search. So the keywords, they were present, mesh keywords present, real literature mentioned, how results were searched, any tool was used, yes, it was done, and the techniques were done. Here I would like to add few points, that quality assessment of the individual studies and assessment of risk of bias for the following points were done, like confounders, selection, classification between the studies, and the intervention bias. These were addressed as a part of an assessment of a risk bias. And missing data was mentioned, and heterogeneity among between the studies was mentioned. That was highlighted by you as well. Then comes the, after that search portion, then in the protocol comes the screening. How the screening was done, it was, I second that it was not given in the form of a flow sheet, but as a detailed search strategy was given. How they retrieved the data extraction was done, and the softwares they used were also mentioned that were handled, and Covidence is also a new software, that is a web-based software that assists the researchers to screen the references, and the data extraction can be done. Then comes the data that is extracted from the screening of the studies, and it should include authors, year publication, origin, aim, purpose, study population, methodology, intervention, key findings. So some of the points that were highlighted in the data that were among the studies there that is selected, I have highlighted them. They were present, and they used the Prisma extension for the scoping review for their whole article. Then the results section, the mentioned is a summary of the studies, and charts were given. Descriptive formats that aligned with the objectives was given, and a flow charts were given, and evident characteristics were also mentioned. Discussion, they have, but as you have said that they have not summarized it in a form of a table, so they were not very clear, but the strategies and the rationale they were up to, that was all in line. In discussion section, the results were as such not discussed in details, but the limitations and strengths were mentioned. Conclusion was given, and conflict of interest was mentioned. And I would like to add that source of funding was also mentioned on the first page, and the company was also mentioned that funded for this whole protocol, this review, and acknowledgement and references were given. So this is the whole thing, that how you should for the next time, anybody who gets a scoping review should add these points. If anybody has any questions, the house is open for discussion. That's all from my side. Anyone? Okay, Dr. Ramsha, you can end this meeting if everything is clear. It was a very nice presentation, and I think you were able to understand the how the whole systematic review literature review was done. So add some of the points I've mentioned, and then upload it on YouTube. Thank you.
Thank you very much. Thank you very much, Dr.
Allah Hafiz. Allah Hafiz. Allah Hafiz.